Hello students, welcome to the channel Medical Media. We have already seen the basics of tracts. Today we are going to learn about spinothalamic tract. Now spinothalamic tract, they are of two types. Lateral spinothalamic tract and anterior spinothalamic tract. As you can see in this diagram, this is a section of spinal cord which shows the lateral and the anterior spinothalamic tract position. Now let's begin with the course. The first order of neuron begins in dorsal root ganglion. Now the axons of these neurons, they enter the dorsal horn cells of the spinal cord. The fibers which have entered here, they form the tract of Leisure. Now these fibers along with the cells which are present in dorsal horn cells, they form substantia gelatinosa of Rolando. And from here the second order of neuron begins, which immediately crosses to the opposite side. Now as shown in the diagram, you can see the lowermost fibers. These are the sacral fibers followed by lumbar fibers, thoracic and the cervical fibers. In the lamination you can see that the sacral fibers, they lie most outermost. Medial to this are the lumbar fibers, thoracic fibers, and the innermost column, it is formed by the cervical fibers. These all together, they ascend upwards and form a spinal lemnisci. The spinal lemnisci, as it ascends upward, it is joined by the internal arcuate fibers which are formed by the dorsal column tracts, and they are coming from the opposite sides. Together these two, they form the medial lemnisci, which further ascends upwards and synapses with the postero-ventronucleus of the thalamus. Now fibers from here, they form the third order of neuron and pass via the internal capsule to the sensory cortex, the area number 3, 1 and 2. Now let's see what are the functions carried by these tracts, or what are the sensations carried by those tracts. The lateral spinothalamic tract, they carry two important functions, which are the pain and temperature from opposite side of the body. Similarly, anterior spinothalamic tract, they carry crude touch and crude pressure sensation, which is from the opposite side of body. Along with this, anterior spinothalamic tract also carries sexual sensation, itch and tickle. Now let's see the applied. The disorders which can affect those spinothalamic tracts are Tabes dorsalis, which is the syphilitic infection of the spinal cord. Syringomyelia, a condition where a cyst or a cavity is formed, which could be an acquired one or a hereditary one. Third is hemisection of spinal cord, also known as Brown-Sequard syndrome. And finally, complete section of the spinal cord. So any of these disorders, they can affect your tract. So students, go through this. If any suggestion or any difficulty is there, you can comment me in the box. Thank you.